Well, this is the podcast. I'm Matt.
I'm CJ.
And we have a very special guest, Maria Zenz, with us today. So, why don't you tell us about Maria a little bit?
Yeah, well, I'll give you a little background. She owns Minster Individualized Therapy, and stated from her website, she opened her practice in 2018, and the clinic is deeply rooted in the belief that each patient deserves individualized care. The clinic specializes in the care of all ages and genders who have prenatal, postnatal pain, pelvic dysfunction, orthopedic issues, chronic pain, and countless other diagnoses. Pelvic dysfunction can include any type of pain in or near the pelvis and difficulties with the bowel, bladder, and sexual health.
That's a lot.
It is a lot.
So welcome.
Thank you.
This is awesome. So why don't you tell us a little bit about yourself?
Yeah, so personally, I grew up in Minster, so local to the area. Currently live in Spencerville with my husband and my two little girls. So I have a 2-year-old and a 6-year-old. You will spot them probably around the box here on weekends, for
already
sure.
Have.
So yep, already have. And professionally, so I am coming up on 10 years of experience as a PT. I went to the University of Findlay, graduated there with my master's in 2010, started working in Findlay, then transitioned down to Lima, where I worked for 8 years and kind of worked my way up in an orthopedic practice. Eventually was the regional coordinator, kind of ran a bigger orthopedic practice. Very typical insurance-based model. And then in 2018, Dr. Sunny Lomnicki and Dr. Tyler Lomnicki, Dr. Kurt Olding, who I all knew from growing up, they kind of approached me and said, hey, have you ever thought about doing your own thing? And that's how I formed my practice.
Wow.
So,
That's awesome.
Yep.
So let's talk about the family. Married, your husband is a school teacher.
He's a special ed teacher. In
Spencerville.
Yep.
Right? Children. So you wake up one day and say, hey, I'm just going to go out on my own, full-time career, going to open my own practice, going to do it all on my own. How did that come?
Yeah,
that's a big decision.
Slightly crazy. So I think my husband is no stranger to me just like going out and doing, putting my mind to something and usually doing it, right? So it's kind of been my personality always. So that's how I worked my way up in my last job. But we were on our way to Philadelphia. So first trip after my second was born, we had time to talk between ourselves for an extended period of time, 7 hours in the car. And he looked at me and he said, if you could do anything career-wise, what would it be? And I said, well, I'd be doing exactly what I'm doing, but for myself. And he said, why don't you? And so that's kind of where the idea kind of blossomed. And I said, you know what? This is a great time. I mean, no time's perfect, right? So I always tell people that come up and ask me, like, what made you brave enough to open your own thing? And I said, well, maybe crazy enough, I don't know.
That's right. Could be part
I think
of
it could be
right?
slightly that, you know, I'm just like glutton for punishment. I'm not sure. But I just thought, you know, there's never going to be a perfect time. Our lives aren't going to slow down anytime.
That's right.
So if I'm going to do it, I'm going to do it. And if I fall flat on my face, then I do. But fortunately, we're at a year on Saturday. So that's pretty cool.
That's awesome.
Yeah, it's crazy.
So a year already.
It'll be a year on Saturday that I've had my practice open. I took my very first patient on December 1st of last year. So,
that's cool.
It's pretty crazy.
Have you seen, like, so, and I'm sure we'll talk about this in a little bit, but you've taken a step kind of out of the typical insurance, typical doctor, here's where we're going. Have you seen that change in the last year?
As far as
just picking up your business, picking up from hey, I would much rather go to, you know, somebody that's going to treat me correctly long term than go to a doctor and do the traditional kind of traditional route.
The beautiful thing about Ohio is we have direct access for physical therapy. So a lot of people don't realize that if you strain or sprain. So, you know, 10 years ago, if you rolled your ankle and it was really bad, you would go to your doctor. They would prescribe x-rays. They would talk to you about what's going on, and then they would prescribe physical therapy. So then you would see the PT, right? But you have probably $500 at least before you would come see me.
For sure.
Now in Ohio, they can just call me.
They can go to you direct.
So they don't have to go to the doctor.
They don't have to go to the doctor first.
That's nice.
So when we have deductibles that are, you know, $5,000, $10,000, $15,000, we know we're going to pay out of pocket for up to that amount. So a fee-for-service practice makes sense.
For sure.
So I have a much lower fee schedule. It's very affordable. It's transparent. There are no hidden fees. It's not one of those things where you walk into the PT clinic and then you go, well, here's my insurance card, and 3 months later I get this bill because I had no idea what my charges were going to be. So a lot of patients respect that. They like it. They know what it's going to be out of pocket. They can use their HSA, their FSA card. And the great thing about my practice is that I can treat people from start to finish. There's no like any assistant that's kind of picking up, you know, where I left off and trying to muddle through. And so I see people less amounts of time. So I see people maybe 1 to 4 visits usually.
Right.
Instead of, you know, where it used to be like 12 to 15, shuffled between people. So that's pretty cool.
So is that a lot different from the corporate setting then?
Yeah.
So is that
it's
a lot more personal probably?
Yeah, I mean, insurance, there's definitely a need for an insurance-driven model, right? So if you have a total knee replacement, for example, and the doc wants you there 3 times a week for 6 weeks, you know, the insurance-driven model makes sense, probably. But if you are just struggling with maybe a muscle imbalance, or you know something's not moving right, or you're in that postnatal period and you need that specific care, you come see me for 2 or 3 visits, and so 2 or 3 total hours, and then a lot of home stuff. And so, you know, with our fast-paced life, I feel like that's a little bit more conducive to people's lifestyle now, so it's nice. So.
Yeah, and that's a different type of investment.
Yeah.
Right? Because it's not like you're going to the doctor for 10 minutes and they're going to prescribe whatever you need, and then you don't see them or follow up unless there's a follow-up in 6 weeks. Hey, we'll see you in 6 weeks.
Yep.
You know, or if you don't have any continued issues, then we don't need to see it. So
exactly.
So this way, it's one-on-one. It's more personal. You're invested in the follow-up of you know, the individual.
I really personally try to get to know my patient really well. Like I want to make your goals specific to what you want. So what's your lifestyle like? What's your goal as far as exercise? What's your goal as far as work? What do you do for work? Let's break all those movements down. What do you do for raising your kids and taking care of your kids? And think about that as, you know, when a lot of people say like, oh, I don't lift weights, but they lug their kids around all day, every day.
That's right.
And so I'm like, well, let me see you pick up an object like your kid who's not even moving, and so the child would be moving and squirming everywhere, and if you don't have that stability to do that, then you're probably going to fail at home too. So
that's interesting. Go ahead.
Well, I think that's a really important thing. Like we do that a lot here too. Like we meet you where your needs are. You don't have to come and meet us. So I think that's really that's awesome.
That's right. The CrossFit model kind of speaks to, you know, where are you at in human movement? We talk about functional movement patterns. Well, what's functional? Picking up my child or my grandchild, or grabbing, you know, a case of water off the floor to put it away or put it on the shelf, right? So all of that is
the clean right there.
all of that is functional. And maybe traditionally, if you would go to, let's say you'd go to a doctor at some point in time, you got a little back pain, a little back issue, they would say, hey, you need to avoid, you know, deadlifting. Don't. If you're a weightlifter, avoid deadlifting at all costs. Well, then I have to avoid.
Hopefully your kid can
90% of what I do, because
you
couldn't pick anything up.
Don't do yard work.
Don't do yard work. Don't bend over. You know.
Can't grocery shop.
Let's learn how to deadlift safely and correctly, so that you can do those things in everyday life.
So how to brace for those functional patterns, and then move forward from there.
And that's definitely my passion. You know, if you've worked out with me in here and I see you moving maybe the wrong way, or I feel like you're going to hurt yourself, I usually jump in, whether probably whether people like it or not.
No, that's
but
good,
it's,
right?
You know, it's just
that's
like
good.
in my nature. So and which is, it's awesome because everyone here just wants to get better, right? So
that's why they're here in the first place.
Right.
I think it's interesting from a CrossFit coaching perspective. We talk about, when we go to the L1 and the L2, and you talk about human movement and how do you set up for a squat. Well, we've got that dialed in, right? We can protect you in any movement you want to do in here, until you have something that's majorly changing in your body, traumatic to a point, pregnancy, right? So you go to an L1 and they'll address how to modify for illness and pregnancy and everything else, but we don't address how to properly brace, how to come back from that. You know, what do we do post? What do we do through the pregnancy even? We don't talk about that at all.
Because it's kind of a niche, right?
Yeah, for sure.
So, in the CrossFit world, and that's something that I really want to bring in 2020, which I know we're going to talk about. But I'm going to kind of hopefully fill that gap in care with our coaches and then with actual athletes or just participants, right? For whatever kind of exercise you're doing. Let's talk about what are the changes we need to make in the prenatal period and what are the big changes we need to make in the postnatal period to protect our bodies and keep us lifting weights until we're in our 60s, 70s, and 80s, right? That's the goal. So I want to be able to teach those things in a workshop, which is going to be a huge thing starting in January 2020.
Yeah, so, that's great.
I'm very excited for that.
Yeah,
I had no idea. I didn't know it was different. Like.
Yeah, nor did I.
Right.
Yeah, and I saw you working with an athlete this morning. Just in bracing, and she's had children, but it's been years.
Yeah, I was paying real close attention to that.
It's been years ago. But even her youngest, let's say, is 5 or 6. Even now, it's important to understand how to change the way we brace because of what we've been through.
Yes.
Right?
Yeah, even more so. And then you have other things that happen. So one of the biggest things I see in those moms is 5, 6, 7 years later, they've gone through maybe some back surgery, some minor back surgery, or they've had some disc herniations, or they have SI joint issues. Those don't happen by chance. That's because we have postural abnormalities, we have muscular recruitment abnormalities that happen during pregnancy, that if those aren't addressed and fixed, those are the issues we have later on. We have pelvic prolapse, we have incontinence issues, we have, lots of other things that are kind of our body's red flag of saying that there's something going on. But a lot of people just don't even know that there are options for how to address that. They kind of just chalk it up as, that's a part of after you've had babies, that's just normal.
Right.
It's not normal.
Not normal. Yeah.
So the muscles change, right?
Yeah.
Obviously to accommodate the weight and stuff.
Yep.
What if you just had, you just carried around like a 9-pound ball in front of you all the time?
Yeah, so...
Do muscles adapt to that?
I don't know.
I don't know why.
Why don't you try it?
Maybe I will. Experiment with that, CJ. It's more of the internal pressure and changes that really cause that. So I think you would just probably have some postural abnormalities carrying around something.
Yeah, because that's interesting. You're not only carrying the weight, right? It's redistributing everything in your anatomy. Yeah.
So I don't know if you guys know this, but when you are pregnant, your rectus abdominis, so your six-pack muscles, split in the middle. There's a connective tissue called the linea alba. It's right in the middle, right? So it's this fibrous connective tissue. 100% of pregnant women will split in the middle. They have to during the third trimester because where else is your big belly going to go, right? So afterwards, it doesn't magically just seam back together. For some people, over the next 6 to 9 months, maybe it'll come back together fairly functionally if they are lucky. Typically with more pregnancies, it's going to split apart again and then not come all the way back together, but it's called a diastasis recti, and that predisposes you to low back issues, disc herniations, the mom tummy that people can't get rid of and they don't know why. They lose weight, they start regular core exercises. You see them in here and they're doing a gazillion crunches and planks or anywhere. You see them in Anytime Fitness, because they aren't aware that they shouldn't be doing those things. And then their belly gets split further apart and it becomes more dysfunctional. So that's where I really want to educate the coaches and the athletes and whatever realm of exercise you're doing, whether it's at home, beach body, or in a gym, to know what's safe, know what's not safe, and then know how to get yourself all the way back to full go, unrestricted movement.
So there is a way to get back to
absolutely
normal.
I had a 4-finger split and my abs are closed. So
nice work. That's great.
It's the reason I got into pelvic rehab in the first place. When I had my oldest daughter, I had a super fast labor and delivery, and afterwards I remember looking at my husband and saying, I have no idea how to put myself back together. I have no idea how to get back into normal exercise safely because I am trying and it doesn't feel right. And so I went to my first pelvic rehab course literally to fix myself.
No kidding.
Cool.
That's great. That's a great story. I know we're going to speak with Dr. Libby Wilson later, early next year in January, and she had the same thought process, right? Here's an MD that she sees patients all the time, like you have, and they're like, hey, how do I correct my weight? From an eating perspective, let me get back to you on that.
Good question.
Right? Because we spent 11, 12, 15 years in getting our doctorate, but we didn't dive into nutrition. And then how do I sleep better at night without medication? And, so she's corrected herself. She's like, hey, I'm going to fix this. Yeah. And then let's fix the rest of the population.
And that kind of aids into the practice what we preach, right?
That's right.
So I always respect someone that I see is living the lifestyle I want to be
right.
at, or
For
physically
sure.
doing the things that I want to be able to do, right?
Yeah.
So I listen and I respect what they're telling me because I can see that they can do it.
Yeah.
You know, they've taught themselves. And so I just felt like I came from a very strong outpatient orthopedic background. And so I knew I had a lot of experience with musculoskeletal conditions, but pelvic rehab is just something that's completely different. It's not something an entry-level PT can do. You have to go to extra certification courses. And I've really made an investment to make sure that's a well-rounded perspective. So I go to different places, traveling all over really, so that I'm not just learning from one institute, I'm learning from lots of them.
Yeah.
And
That's
taking
huge.
pieces, because I think that that's how I'm going to best serve my patients.
Yeah.
So
Constantly learning. There's no
Yeah.
different. It's like going into a CrossFit box when I travel and I listen to another coach and I'm just a normal member, right? I
Yes.
come in for the class and you're like, wow, that's, you can pick up things. That's a good cue. I've
be a
never
sponge.
thought of it that way.
Right.
Yeah,
Right.
be a sponge.
Yeah, constantly
always.
learning.
That's why I think it's so important for the coaches to go through every movement and all this stuff like before, just because there could be one thing where like even now I've been doing it for like a couple years. I come in, Matt says something, and I'm like, oh, I never thought of it that way. Like that's
Yeah.
good.
Yep.
Yeah.
So-
Always learn from someone
Yeah.
else. Yeah. And I think it's important that we fix movement pattern early, especially coming, after a pregnancy,
Yeah.
right? Because as we age, things change. It's no different than, and let's talk about our grandparents, as they age, right? You typically see people start to narrow their feet, and then what happens? They fall or they slip because now their stance is so narrow because they don't have the mobility
Yep.
that started in their ankles and knees.
Right.
Now their hip goes because they fell on it.
Yep.
Right? We work with our special needs, Special Olympic kids. And one of the things we told them is it's great to go to the Special Olympics. That's a great goal. But our goal is to have them gain strength because as they age, it's even going to be worse for them, right?
Yeah.
So we need to make sure that they can move functionally well now and they have strength. So as they age, they won't deteriorate as bad as they would if they didn't have that
Right.
stimulus and activity.
Yep.
You
Yep.
see that in your practice as well, I'm sure.
Absolutely, yeah. I always tell people, it's never too late to fix your body. So when I hear moms that say, oh, well, I've had this belly for 20 years, so it's never going to close.
Yeah.
And then two visits later, I say, hey, guess what? Your core's closed.
Yeah.
And they're like, oh my gosh, how did I not know to do this? And I'm
That's
like, well,
right.
first of all, pelvic rehab's only been around since the 90s. So,
Yeah.
there weren't many of us.
Sure.
And so now we're hearing it and seeing it more and more often that people are advocating for it. Physicians are advocating for it. So that's awesome.
Yeah.
So, yeah, like talk to your OB, talk to your doctor, because they may not always remember to mention it, that it's an option, but I've been around to enough of the area docs and OBs now that they're familiar with me now.
Yeah.
So if you say, I've heard of this pelvic rehab, they're like, oh yeah, that light bulb goes off and they're
Yeah.
pretty happy to send over a script.
So that's a good point. And CJ, you asked this question about doctor versus
Right, physical
rehab or
therapist.
therapist.
Yeah.
How'd you phrase that? I forget exactly.
Well, so how does someone know whether they should be going to a doctor or a physical therapist?
Okay.
A medical
so,
doctor. Or
Yeah.
physical
So
therapist.
one of the things that the APTA, the American Physical Therapy Association, has established is that PTs have to be able to differentially diagnose. So we have to be able to know the red flags of when we feel like it's outside of our scope, right? And then we're going to send you for the medical imaging, we're going to send you for physician testing and that kind of stuff.
Right.
So if it feels like a strain, a sprain, mobility issue, strength issue, we're the people to go to. If it feels like you all of a sudden found this lump that's unusual and doesn't
Shouldn't be
seem to
there.
get better or worse depending on movement, that's more of like a doctor, conversation. But
Sure.
we should be able, you should be able to come to a PT and they should be able to kind of point you in the right direction for sure. I am never one to say that I can fix everything, right? So you always want to be just like humble in your skills and know when to refer on. And I think, I've developed that over the last 10 years. So,
cool.
yeah.
And I don't know if I said medical doctor. I guess physical therapy can be medical too.
Yeah.
So just medicinal doctor is what I meant first.
Yeah.
Like needing a prescription
Right,
versus
yeah.
needing.
Exactly.
I've got a cold.
So I didn't want to
versus
like
a
Yeah.
shoulder
right.
Yeah.
I
Yeah.
didn't want to diss every physical therapist out
Yeah.
there.
That's right.
I understand what you're saying.
That's good. That's good. Cool.
But so I guess quick question, like we were talking about pregnant women.
Yeah.
So does the most damage come from carrying or from giving birth?
So that depends on the person.
Okay.
Carrying a baby by itself does a number on your body, right? And it also depends on what kind of a pregnancy you have.
Yeah,
you know,
I was
you have
gonna
your
say,
moms
does it
that gain 12
C-section or
pounds.
not, too?
Well, yeah, and you have your moms that gain 12 pounds, and you have your moms that gain 75 pounds. And so, that's a huge difference.
Right.
So pregnancy for some women can be an amazing experience, and they have no issues. Pregnancy for other women can be absolutely miserable. There's lots of factors there. During pregnancy, I start seeing people around the second trimester, usually once every 2 months or so until the very end, and then I see them like once a week until they deliver. If I want to help them ease that transition process, we also start recovery exercises at that point so that they can start them literally day one in the hospital.
So you understand what they're doing and go from there.
Yep. And because, as a mom, you have your baby, so you give birth to this child, and then you go home, and you pretty much start your normal life back up.
Yeah.
So you get this like 6-week recovery time.
Right.
That's not recovery time.
You get the 2 days in the hospital.
Yeah, so then you get to your 6-week postnatal checkup with your doctor for the first time.
Yeah.
And they say, okay, go ahead, green light, you can do whatever you want.
Yeah.
And you're like,
but I haven't done anything.
No idea how to do that. Or I've done too much. Or you've already damaged yourself because you have no clue how to rehab yourself.
Yeah.
In those 6 weeks after you've given birth, you could be doing gentle pelvic floor and core stabilization and restoration exercises if you know what to do.
Yeah.
So I'm a huge advocate for that. That'll be a little bit of the workshop that I do too. I'm just kind of talking about like what are those things you can do.
Yeah.
So yeah.
I think it's so important. I keep going back to that coaching perspective that we do in this setting. If I'm a layperson, I'm going into a 24-hour gym somewhere. I don't have any of that background. I don't have any of that knowledge. The other thing that's scary to me is I don't have somebody watching my movement. Like, hey, you probably shouldn't. You probably shouldn't do that.
Yeah.
That at that rate or that speed or that intensity or whatever it may be.
Yep.
But I know for us, from a CrossFit perspective and a coach, those are things I don't know about a female anatomy, and how do I properly take one of our athletes that just gave, just gave birth, and now they're back. They're released at 6 weeks.
Hey, I'm back.
Yeah.
Okay.
And then
let's
you're like,
squat.
okay.
Yeah. Let's go squatting.
And then you teach them bracing just like you normally would. You teach them everything.
Yeah.
Right.
Just as the same athlete, but you have no idea.
Yeah.
Especially as a male, like that's not something that goes through your head even.
Nope.
That's right.
Yeah.
And I mean, it might not for them either.
Right.
So that's like how you're starting that early, like before they actually give birth. I think that's really huge because that'll give. Then they do give birth. They go home and they're like, oh, well, I can be doing this stuff. Like she told me to do it this way.
Yeah.
And then they know they can be doing something, or they know they should be doing something.
Yeah.
So if it tells you from a personal standpoint, I had my first, so I gained maybe like 15 pounds during pregnancy, and I had an almost 8-pound baby. So I mean, not much, right?
Yeah, right.
I had a 4-finger split. Like that is a huge gap.
Yeah.
4-finger split. That's huge. When I went back to exercise, I couldn't close it. Finally figured myself out with pelvic rehab and lots of research and experimentation on myself, basically.
Yeah.
Closed it. Got pregnant with the second. I had a 2-finger gap when I had her.
Right.
Instantly started recovery. At 6 weeks, I was closed.
Yeah.
But I knew,
Knew
the
what to do.
knowledge is power.
Yeah.
So I tell my moms that all the time. Knowledge is power. You have to figure out what's going to work for your body and then start implementing that into everyday life. And I felt a million times better after having my second. So, I'm a huge advocate for the power of pelvic rehab. It's so important. And it's giving birth is a huge thing. I mean, our bodies, pregnancy and then giving birth that's a huge impact on your body. Your body changes in a million ways. So it's so important to figure out what's my new normal.
Yep.
What has this baby basically done to my body, and how do I get myself back to be able to safely lift and be able to safely progress. And
that should be something that's like extremely well known, because most women are going to give birth.
Right.
Yeah.
A lot of women give birth.
That knowledge should be out there.
Absolutely. And to touch on like anyone that's had a miscarriage or any endometriosis or those things that maybe they can't have children but they've had a lot of pelvic floor trauma, that's something else I work with all the time, and it's equally as important.
Yeah.
So you don't have to live with pelvic pain. You don't have to live with dysfunction. You don't have to live with like 2 weeks of your every month are miserable for you. That's all stuff we can work on. So it's really important that you just advocate for yourself and that you want a pain-free, healthy life. So that can happen. So.
Yeah.
And a lot of people don't know that's possible.
That's right.
Exactly.
Yeah, because you live with pain.
You
for
just
so
live
long.
with it, and then that's your new normal.
And that's orthopedic issues. That's female-specific issues. Yeah. Living with pain is not normal, and chronic pain is extremely detrimental on your body. Yeah. So get out of the pain cycle.
Yeah.
We can help you do that.
Both mentally and physically.
Exactly. Yeah. So that's the beauty of the partnership here is that I can get people out of the pain cycle, and then you guys can keep them moving, and then start them moving the right way, and keep them in that groove. Because movement's going to heal you. It's going to make you really healthy. It's going to keep you healthy. It's going to prevent injury. So it's important. So
we've talked a lot about the female anatomy, and I have one more female question.
Yes.
But I also want to understand what do you typically treat people for, and we'll get to that in a minute, both male and female. So our audience understands. Oh, hey, I've got a little back thing that I could probably get, or a headache, right, or something like that.
So we're talking a lot about prenatal, postnatal, right?
Yeah, right.
But I can see people for orthopedic issues head to toe. So it's a huge passion of mine. I love CrossFit. I love movement. I always call it peeling back the onion, but figuring out, like my hip hurts right here, but I don't know where it's coming from. Let's figure that out.
Yeah.
So I have certifications in ASTIM therapy, which is a manual tool-assisted mobilization technique, in neurologic dry needling, which I use all the time for chronic pain, sprains, strains, any inflammatory issue, basically.
Headaches,
migraines. Shoulder issues.
Yeah, that's right. Rehabs.
All kinds of stuff. So, and then I do cupping, and then obviously traditional exercise, stretching, that kind of stuff that's tailored to you.
Yeah, well, and that's really the dry needling portion of that. A lot of people are like, ooh, what's that about? Or I understand what that is, but that can't be good for you, right? You're poking needles, and I want to understand a little bit about what dry needling does internally. Yeah. But one of the things, I was less than a week out of surgery with this surgery, right? We're talking about dry needling. We literally send in our visit. She's like, "Hey, can I dry needle in and around the bicep and the shoulder?" Right? So we send my surgeon a text message. This is how good this guy is, right? We send him a text message. Hey, how about dry needling in and around the surgical area, the bicep, right away? No problem.
Yep.
So here's a surgeon that says, that's probably going to promote healing, well, I'll let you talk about what it physically does. Yeah,
so shout out to Dr. Atiba Jackson, by the way.
That's right. Phenomenal.
He's phenomenal. Takes really good care of his patients.
Definitely.
So I always clear it with the surgeon, because obviously they're the one that just cut your shoulder open,
right.
and they're the one that gonna make that decision.
Exactly.
But dry needling itself, neurologic dry needling is a little different than like trigger point dry needling. So you can get certified in either one. I chose the neurologic dry needling route because I feel like, again, it kind of peels back that onion. It gets to the root of the problem. And so we're taking a acupuncture needle, which is super tiny, super thin and flexible. In some cases, don't even feel it.
Yeah.
So I dry needled CJ's neck last week.
Oh my gosh, she saved my life. My neck was like, I couldn't look, like I could only look right with my eyes. And then I told her right before the podcast, and she's like, oh, well, let's just throw a couple needles in there.
Yep.
And I'm like, I don't want to get stabbed in the neck. I'm like, what the heck? But we go back there, and I was just like, she was like pinching around, and I'm like, I'm not gonna lie, I'm pretty nervous. And she's like, well, there's 2 needles in already, so I think, and I was like, oh.
I said, like, okay. I think you're gonna be okay. Yeah. So
and
that's kind of the reaction I get.
Yeah. But then by the end of the night, I'm like, I had full range of motion, I could move. I was like, I'm gonna hit Maria up more often.
So dry needling is pretty powerful. We take that needle, and obviously lots of training involved behind it, lots of science and anatomy, but we figure out where's your pain coming from, and let's create a little micro lesion with that needle, which basically, essentially, just tells your body, hey, I got to rush a healing response to that area.
Right.
So all of a sudden we get this circulation, we get all the healing things that come with blood and circulation and that effect, and it basically, you heal yourself.
Yeah.
But we just kind of speed up that healing process.
Yeah.
I always say you kind of poke the bear the first time,
right.
so you get that central nervous system response. But it's very interesting. Some people will come in with chronic pain. We have a little test that we do to see how sensitive is your nervous system. And people that have chronic pain typically are positive in all 16 spots.
Wow.
So basically, what we have found is that once you have pain and a pain cycle that continues, you get an inflammatory marker in your blood, and all of a sudden other things start to hurt. So you hear and see people that say, like, my whole body hurts.
Yeah.
And it's truly
That's
their
why.
entire
It
body
probably
hurts.
does. Right.
It really does. And so we start working on what we call homeostatic points, and we break that down, and it's really cool because I'll make basically a map of your body front to back. And maybe the first time you came in, you had 50 positive sites, right? So I figure out where I want to go first, and then those 50 sites go into maybe 30, and then 15, and then just 5 little sites.
Right.
And all of a sudden, the patient can go from this overwhelming pain to, okay, so now just my shoulder hurts right here.
Yeah.
Or just my neck hurts right here. And they can actually isolate where
Pinpoint
it's coming
it.
from. Yeah.
Yeah.
So it's pretty cool. We
That's
can kind
cool.
of reverse that process of chronic pain.
Yeah. And look
Wow.
how medicine has come from that perspective. Maybe 15 years ago, or even 5 years ago, right? I would have went to the doctor for
Yeah.
that, and I would have gotten maybe a painkiller and a muscle
Yeah.
relaxer,
Yep.
right? And you would have been said, hey, follow up in 3 to 4 weeks, and maybe we'll get an X-ray then if
Yeah.
there's something going on.
Right.
Yeah.
And then you have
Right.
to live
Yeah.
with that for that much longer too.
Yeah. Yep.
Yeah.
Or a lot of my migraine sufferers have been on like high levels of meds for a long time.
Yep.
And they are seeing the effects of that.
Yeah.
And so they want to start decreasing their meds, but every time they try to, their
Yeah.
pain becomes overwhelming. Needling has helped so many people
Yeah.
with that. They'll just see me on a monthly basis. After we get it under control, their med levels are down, then they see me just monthly.
Yeah.
And we do kind of maintenance visits.
Yeah.
So
That's the thing. What side effects are there from dry needling?
soreness.
question.
Yeah.
That's a great, it's a great question. Sometimes if you're not properly hydrated, people will feel like they got hit by a truck the next day. It's like flu-like symptoms without the fever. I always tell people if you have a fever, you have the flu.
Yeah.
But if you
Yeah.
don't,
Yeah.
then it's probably just from the needling. Sometimes your central nervous system is so mad that like I said, you poke the bear and it doesn't know what to do.
Right.
So you get
Yeah.
this like overwhelming soreness.
Yeah.
And that happens very rarely, but it does happen. Sometimes people are just kind of achy the next day, and then usually by day 3 is where they see a huge drop off in their pain.
Yeah.
So-
Because I know I had no idea what I was getting into when you did it to me. And
Yeah.
then I had to coach 5 minutes after that, and it was kind of like stiff still and warm, and I was like, I don't know what's happening.
Yeah.
Like,
And that's
but then
that blood
you told me
flow.
right.
Yeah.
And then you told me just to like drink a lot of water and stuff
Yep.
throughout the day. And then 4 or 5 hours later I was like, I feel awesome.
Yeah.
And then but I mean that side effect is nothing compared to all these pain meds and everything that are prescribed anyway.
Yeah.
Yeah,
So
sure.
I have a cousin, actually, she fell off her horse like 7 years ago, right? So she screwed up her hip, lots of soft tissue damage, and just kind of like lived with it.
Yeah.
And she would like have this cyclical pain, and every time she would try to work out harder, she was having issues. She came in for one needling session, and I just saw her on Sunday at Thanksgiving.
Yeah.
And she said, I meant to text you. I have had 0 issues.
Isn't that awesome?
One session.
Yeah, that's
and she was
awesome.
like, why did I live with this for 7 years?
right.
That's how many people are
So-
asking that question.
Yeah.
Yeah, but it's this huge mental hurdle. You hurt something, it's not bad enough, you don't want to go the whole doctor route.
Yeah.
Know that there's an option there for something like that.
That's right.
Just take care of it,
Yeah.
Come call,
Make
come
the phone
in,
call.
Right.
make the appointment.
Yeah, people like that's going back to the same thing. People don't know. You don't
Yeah.
know there's an option.
Yep.
We have people at our intro sessions. They'll come in and like, they're like, "Oh, I'm 40 years old. I can't get my butt to my ankles when I squat."
Yeah.
I'm like,
Let's
you
figure
should be
that
able
out.
to do that. They're
Yeah.
like, no, like people can't do that.
Yeah.
Yeah.
And they can.
People can
Yeah.
do that.
Yeah, with a little
Like,
help and a
people
little
should be
practice.
able to
Yeah.
do that.
You should and
Yeah.
you could.
Yeah.
Yeah, that's
let's
right.
do it.
But if people don't know, so it's just like a limiter in their head.
Yep.
I know my responses with dry needling just on the shoulder. Like we had a rehab session this morning,
Yeah.
so I'm not actively allowed to move my arm outside of just an elbow range of motion and
Yep.
bicep change, right? So I can't power it to do this. Like I couldn't pick up, but she's taking my arm and getting it to this point passively, right? And then taking it out, which this is the most painful. So typically most days my shoulder aches, throughout the day, and I take ibuprofen, right, to dull some of that pain and get some of the inflammation out. But after, you would think it would hurt worse after taking it through that until we do the dry needling.
Yeah.
And then right now I'm absolutely pain-free.
Yeah.
There's no aches, there's no pains, there's no I just got through a bunch of stretching and now I'm tired. So I think that's the natural human body's response to say, hey, let's send that blood flow there.
Yep.
Right? And life is in the blood, and let's heal what's going on.
Yeah.
Life
Yep.
is in the
Yeah.
blood. That's
yeah.
good.
Yeah, everyone asks me, what are you injecting?
Yeah.
Nothing.
Nothing. Yeah.
I am creating a micro lesion.
A
Yeah.
needle,
Yeah.
And it is so
1/70th
small,
the size
nothing.
of a
Yeah,
shot.
yeah, nothing could be injected in those needles.
Yeah.
So, is it painful at all? You may feel a pinch.
Yeah.
Right. So
That's
you have
about
muscle
it.
twitches, and I always tell people, if once the needle is set, count to 1 Mississippi, 2 Mississippi. If it still hurts, I take it out, we move it somewhere else.
Yeah.
Because it shouldn't hurt past that.
Right.
So.
Yeah,
that was the thing too. You had like such good control, like you knew it was gonna happen. Like the first 2, like I said, I didn't feel it, and then the third one, she's like, "Hey, you're gonna feel something here, like your muscles are gonna start twitching."
Yeah.
And then put it in, and I was like, and it was fine. I'm like,
Yep.
how does she know?
Yeah,
Like what?
right. Yeah.
It's crazy.
Yeah. Definitely develop a lot of palpation skills over the last 10 years too. So
Sure.
I'm usually like 90% to 99% sure when I'm going to hit a point that's going to hurt.
Right.
So I try to, just allow people to kind of work through it with me. I talk them through it, and
When she knew, she was like, "Oh, that's the right side of your neck for sure," and I'm like, "What?" She just looked at it. I was like, "I mean, you're right, but."
That's right. Exactly.
Yeah.
Yeah, that's cool. You explained dry needling to me early on, and I thought, and we can move on after this, but I thought it was kind of cool. You said the body's natural response to a scratch.
Yeah.
You scratch yourself, you start to bleed, and the body says, "Hey, time out. There's something going on. Let me send white oxygenated blood cells there, and let me platelet that, clear that up so we can fix it." And the same thing kind of with dry needling, right? We're making those small micro abrasions and
all the way down to the bone.
Yeah. So the body's
yep.
now saying, I got an issue. Let's send extra blood flow there because, again, life is in the blood. If I want to fix it, I need blood flow.
Yeah, so needling is so powerful for recovery, but also for injury prevention too.
Yeah.
We're seeing it more and more with college professional athletes, with CrossFitters.
Right.
Our world, we tend to overwork ourselves at times.
We do.
Once you go for when you're pushing yourself, like in open season or
Sure.
something like that. And so, a lot of us that know that we'll do that to ourselves, we like to push ourselves really, really hard, maybe do a couple wads a day.
Right.
There are a few of those athletes here that, they'll
that's
do
right.
2 or 3 wads a day. And they have seen the benefit of dry needling in how quickly they recover.
Yeah.
And so that's pretty cool too. Yeah.
I think that's important to note, like everywhere, like
Yeah.
in all aspects, like preventative is so important.
Yeah.
Like you shouldn't be, I don't know, like you work out so you don't get diabetes, or you
Right.
know, you shouldn't be like,
Don't
oh,
wait
I have
until you're
diabetes,
injured.
I should start working out.
Yeah.
It's like,
Yeah.
don't
If you
waste
start
your
to feel like your back isn't moving the way it should be, or it's not feeling the way it used to, or your shoulder's not, one shoulder's not getting to end range, but the other one's just fine, go address it before you get hurt.
Yeah.
Before you have a rotator cuff
That's
tear,
right.
Yeah. So there's stuff out there now. There's availability for just seeking treatment. So go get it.
Yeah.
So.
Yeah, and that's just like CrossFit. So there's so many different spectrums that we would look at.
Yes.
Somebody that's sedentary, just coming in, they've sat on their couch for the last 20 years, and they've got a heart condition, and doctor says, hey, you need to figure that out.
Right.
So go find a gym. So they come in, and we can use dry needling and recovery to help that, versus a games athlete that is in the gym, 4 to 8 hours a day,
Right.
pushing their body. And that adaptation, the body's cool about adapting to the stimulus given.
Yep.
Right? We used to say, oh, you can overtrain. I think you can under-recover.
Yeah.
Right? I think what we've seen in professional sports, especially in the CrossFit world, is you can push the body pretty much every day, as long as you are recovering properly. That's sleep, nutrition, things like dry needling, physical therapy, work consistently, not just, oh, something's come up.
Yes.
That hurts. No.
Right.
Long before that. So that hurt thing doesn't come up.
Yeah.
Which is
right?
why most people can't work out that hard or that heavy, because they just can't.
They can't fit in the recovery.
Right.
That's
exactly.
Right.
Yeah.
Yep. They don't have that time to spend.
Yeah.
You have 6 hours of work that you do on your body. Now
That's
you
right.
need maybe 4 or 6 hours of recovery.
Exactly.
That's right.
But some people can't do that, so you have to tailor what you're doing on the physical side of it. So,
Yeah.
Yep.
That's awesome. Yeah, good stuff. So one last question, and I know you had some questions too, but I want to get to the female anatomy real quick.
I think.
So we have
You
this,
get scared.
and
I think I know who's gonna ask.
I think so too, right? And it's not necessarily, for sure, pregnant women coming back.
Yeah.
But it's not necessarily always pregnant, which that's my biggest question, right? But it's the never fails, we go to jump ropes. Whether you're a seasoned athlete or it's the first day in and you hand somebody a jump rope, most of the time the female will be like, hang on, I got to run to the bathroom.
Or I'm glad I'm wearing black pants.
That's right. That's right. Yep.
Yeah, right.
And we've conditioned, because we've seen it so much, we're like, yeah, okay. Right.
Yeah, it was just like,
And we
oh, that's
don't-
just a problem that happens. I don't.
Yep, okay.
I'm not gonna
we
get
don't
in the way.
address it. We
Yeah.
kind of shy away from it from a male's
Right.
perspective.
Or they're just like, this is what happens to women, and you're like, I'm in no position to question
That's
that.
right.
I have no idea.
Yeah.
I'm just
so you're like, I'm out. There's a restroom.
Sorry that happens
Not
to
looking
you.
for a
I'm
fight.
sorry.
That's right.
Thank God I'm a male. I don't know.
Exactly.
Yeah, so public service announcement for everybody. Peeing your pants is not normal during a workout, whether that's running or jump rope or lifting weights.
Yeah.
That absolutely blew my mind.
Yeah.
We
Not
do it from everyone.
normal. That is muscle dysfunction.
Yeah.
That is your muscle saying, I cannot hold that load that you're trying to put through me.
Right.
And so therefore I'm going to pee.
Yeah.
Not normal. I can fix that. So
That's good to
come see
know.
me.
Yeah, definitely. Yes.
Yeah.
Yeah. It's very important.
Very important. It's essentially like if you tried to lift a 30-pound dumbbell just straight up and you dropped it.
Yeah.
You know, you would train yourself
Yeah.
if that was a goal for you to
Right.
be able to lift that 30-pound
Sure.
dumbbell. If
Yeah.
you want to jump rope, which you should be able to,
that's right.
if you want to jump rope without peeing your pants, you have to retrain your pelvic floor.
Yeah.
I can help you do that.
So why does that happen though?
Basically, when you jump or when you sneeze or cough, so those are like the biggest reasons why people say, you know, I pee my pants when that happens. Basically, your pelvic floor is kind of like the basement for your house, right, of your core. And when a big load happens like that, you get this increase in intra-abdominal pressure. Our pelvic floor has to do an eccentric contraction, meaning it's stretching while it maintains that closure. If it's not flexible enough or not strong enough through the eccentric movement, it fails, it opens up, and pee comes out.
Yeah.
Yeah.
And we can fix that.
And we can fix that.
We can't fix that.
You guys
fix
cannot.
We didn't even know it
Defer to
wasn't
me.
supposed to happen.
That's right. Yeah, that's
Yeah, don't try to fix that.
Right.
That's right. That's right. That's right.
That's funny.
We had some good questions.
Do we want to do the final questions or?
So
Well,
let's
why'd
go-
you? I want to. Well, how'd you get into CrossFit?
Yeah, that's a
It's
great.
How
such
did I
a.
get
It's
into
such a.
CrossFit?
Yeah.
There's a lot of like stigma to it or whatever, you know. So I want to know why.
Yeah, so I always thought that I would never be able to CrossFit. Like when I saw CrossFit athletes, I guess, or just mentally, I have since learned that that is the furthest from the truth. And I really actually tell people all the time, you should start with CrossFit if you want to start lifting weights. Because the coaching that you get is different than anything. People will say to me, oh, I'm going to start at a 24-hour fitness. I'm going to get stronger there, and then I'm going to maybe try CrossFit.
Yeah.
I'm
And
gonna
I'm
read
like,
the whole
that's the-
Bible before I go to church.
It's actually just the opposite of what you should be doing because CrossFit's going to teach you. Like, you guys have a Couch to CrossFit program that's phenomenal.
Yep.
So it takes someone that has never seen a barbell, which is extremely intimidating. As a female that was a cardio junkie, I just love to run, right? So my shoulders were like this big, my arms were like this big. And so, you know, if I weight trained upper body, it was like seriously 2 to 5 pound dumbbells. That was it. And I just always thought that was going to be like how I was, you know, that's how I was built, and I couldn't do more than that. And actually, as a PT in Lima, I had a CrossFit athlete come in, and I was seeing her for her Achilles, and I was talking to her because her body, I was like, wow, how do you have muscles like that? Like, honestly, that's where our conversation went. And I said, you know, what do you do? And she's like, well, I do CrossFit. And I was like, oh, okay, so let's learn more about that. And I went to a free Saturday. One of my coworkers was CrossFitting too. So I finally listened to both of them and went, and I did a gajillion wall balls. At least it feels like that. It probably, in retrospect, was not that many wall balls. And I know that I was on like a 6 or an 8 pound wall ball.
Right.
I'm 100% positive about that. But I remember not being able to lift my arms for like 3 days. And I was like cursing everybody that told me to go to CrossFit. And then at the end of the week, I thought to myself, you know what? Like, that was kind of fun.
Yeah.
And I feel like I could get better.
Yeah.
And wow, I woke up muscles that have not been woken up in a long time.
Yeah.
So that's kind of where my journey started.
That's
and,
awesome.
You know, since then I've just fallen in love with it, really.
Onward
So
and upward.
That's awesome.
Yeah,
Yeah.
it's a good story.
competed for the first time a couple weeks ago.
Yeah.
So
Hit a PR.
hit
So-
lots of PRs.
So we
Yes.
go from 2 to 5 pound dumbbells to, what was your PR?
135 on a squat
135
clean.
pounds off the ground.
Yeah,
Wow.
so
To
pretty
shoulder.
big deal.
There you go.
Yeah, and in the open, I push pressed 95 pounds. You
That's
know,
awesome.
Boom.
and,
How long ago did you start?
a year and a half that I've actually been like, you know,
Consistently.
consistent.
Yeah.
A member.
Yeah.
So
Yeah, so that's awesome.
That
so
is
that's pretty
awesome.
crazy.
Right.
And I would like go once or twice a week before that for about a year.
Mm-hmm.
So yeah.
Nice.
Yeah.
And I just run once a week now. So it's just totally different. And I love it. My body feels better than it's ever
Yeah.
felt.
Do you feel your running endurance from a movement perspective, you can run just as well as you did before?
Better.
Yeah.
Yeah.
All my 5K times are better.
Yeah.
And
Isn't
I
that
run one day
crazy?
a week.
Yeah.
And taking care of my kids, such a difference.
Yeah.
like lifting and carrying the kids, I just feel a huge difference.
Right.
Keeping up with them. Like I was chasing around in the yard last night for like an hour.
Yeah.
And I was the monster. So, but you know, like just that kind of endurance.
That's right.
Where like, you know, I was throwing them up in the air, and you know,
Yep.
our oldest is 50 some pounds.
Right.
And I can throw her up in the air.
Because we can push press now.
Yeah.
Yes.
Yeah.
Yeah, and I have upper body strength, and I throw a 14-pound wall ball lots of times, 150 times
Right.
to be exact.
Yeah, Karen, there you
Yeah. So, but you know, you can do that, and
Yeah.
that's pretty cool.
Yeah.
That's awesome.
And from a female perspective, strength training is so important for bone density health as we get older, and just to keep up.
Yeah, probably
So.
more so in females than males.
Yeah, even more
from
so
a
in
bone
females.
density perspective.
Yeah. And it's something like we really lack, because so many women will say to me, "Oh, I can't strength train. I don't want to get bulky."
Yeah. Yeah.
Right?
My
So-
mom used to say that all the time.
Yeah.
She still says that, and it drives me
I don't
nuts.
think I'm bulky.
No. No,
You know,
not
I've been
at all.
doing it for
right.
Yeah.
lots of years now, and so in fact, I'm probably smaller than what I was in lots of ways. So healthier.
Yeah.
The Fit 3D scanner tells me all the time that I'm
Yeah.
getting healthier and healthier and healthier. So that's pretty cool.
That's
Yeah, I
huge.
think that's the misconception. You see these people on TV, right? And because they're in the middle of the workout, so what happens? Blood flow increases, water retention, you bloat, right? Your muscles get much larger.
Yeah.
So you're seeing this female, oh, she's large.
Yeah.
Right? Julie Fouché is a perfect example of that. If you'd watch her during the game, she's a doctor,
Right.
Phenomenally fit. Wow, she's big and strong. And then when you see her, she's your size.
Yeah.
Yeah.
You're like, oh, wait a minute. It's
Right.
that muscle, that
And they're working
response
out
to
8
activity that
hours a
you're
day.
seeing.
Well,
Yeah.
exactly. Yes. Yeah. And you know, really being strong is beautiful.
Yeah.
Right.
Amen.
Absolutely.
So
For sure.
muscles are
Agree.
cool.
Yeah, that's right. You like that. That's
yes.
right.
Yes.
Yeah.
It's all good.
Cool. So I know he's got some closing questions, but I want to find out what is 2020 have in store? What does 2020
2020
have
is
in
a big
store?
year. So, you know, this year has been kind of like finding myself in the professional world, right? So like, what do I want my practice to be?
Yeah.
And it's shaping up to be pretty awesome.
Yeah.
So 2020, I'm going to add the CrossFit L1 certification, so I can kind of start coaching. And then with the workshops, I want to bring that to coaches, and I want to bring that to just everyday people, right? And so I really want that L1 under my belt, just to add to the credentials, really, and know as much as I can know going into those workshops. So the workshops will happen hopefully once a month or maybe every other month, depending on interest level. They're going to be 3 to 4 hours where they come in and they learn a lot. It's like a breakdown of anatomy for the prenatal, postnatal woman. And then we talk all through bracing, core activation, pelvic floor activation, big red flags, things that basically you'll need to come see me for. And then we're going to go through actual like a lab where we're going to lift, we're going to move. We're going to do things in here.
I want to go to that, and I'm not a pre or postnatal
You know
woman.
what? I'm going to actually have a coaching seminar for men and women, and that'll be a huge part of it. So, because it's very important.
Right. I want to
You want to coach
obviously
the
be
right
the
way.
best coach we can be. Yeah.
Yeah, absolutely.
Yeah.
So, I'm really hoping to grow that, and just getting in here more often, growing my Minster practice as well. So. It's going to be a good year.
Yeah, we're excited for all of that, and I think we've talked about this a little bit. I would say once you get that released, buckle up, because some of the biggest misses that we have from a coaching perspective is what you're talking about, right? So not only from an athlete, you're going to have that interest, like, hey, I need, or they're going to recommend, hey, I've got an aunt or an uncle or brother or a sister, that's coming in that's going to be pregnant. But I think you're going to see it from a coaching perspective.
Good.
And I think that would span outside of CrossFit realm. Any personal trainer that is working in that should be well versed.
Yeah.
And I think I've not seen a lot of it, and I think you're going to probably be one of the first that releases something that says, hey, let's take care of these athletes.
Yeah.
Right.
And
Any
here's
personal
why.
trainer and any woman.
Yeah.
Most
right.
women.
It just feels like a huge gap in care. Like, I always say that knowledge is power. So let's figure out, like, how do we get this information to as many people as we can? Because it's going to protect women. It's going to protect us. And it's going to allow us to meet the goals that we want to meet physically in a very safe way. So that's important.
Yeah, that's great.
Good.
Yeah.
So, beginning of the podcast, I just want to touch up on this quick. You talked about bringing your kids to class.
Yeah.
We got a lot of people that they're like, well, like, I can't go because I have to watch the kids at home or whatever.
Yeah.
Like, you can bring your kid to class. That's perfectly fine.
Yes.
Yeah.
Childcare is offered in the evenings.
That's right.
That's right. So even with the littler ones, we have lots of super moms here that just bring their babies in carriers and just keep them over here.
That's
and if in the middle of the WOD you have to go insert a foo-foo in their mouth, that's okay.
Good.
We're good with that.
Or a coach will go do it.
Yeah,
exactly. Yeah.
Or you'll see a coach holding one of my kids. That happened on a Saturday. Jamie was awesome and sat back there and held my 2-year-old because she wanted held. And so that's pretty cool. It's a big community. CrossFit's a community. So when you're here, we're going to support you in all ways. And if that means that we're going to chase after your kiddos, cool.
That's a part of it.
Right, exactly.
We'll do it.
And I mean, I think that's huge as a parent. Like, you're doing a great service to your child as a parent. If you're getting them, like, hey, my mom's taking care of herself, I should take care of myself. Or, like, you're lead by example,
Yeah, our 6-year-old is learning how to jump rope, and she's asking for little mini barbells for Christmas, and that's awesome.
Yeah, that's cool.
I know that I'm teaching her a healthy lifestyle right now.
Right.
And she's going to keep that up.
Yep. Yeah, she's going to mimic what they do, for sure.
Yep.
Nice.
Good stuff.
Cool. So, 3 closing questions.
Okay.
First one, what is a couple of things you do every day that have a positive impact on your health?
Okay, so number 1, meal prep. That's been huge. So as I've adapted my exercise lifestyle, my physical lifestyle, I've learned that I need to nourish my body a little differently, right? So I was like a 0 carbs person, and I've learned carbs are awesome for growing muscle, and they're good for you. Yeah. And so I've learned that through lots of different things, but mostly through professionals. That is not something that's inside my scope. I mean, I've learned a lot, but defer to a nutritionist, like definitely. Nick Fiore. I can never say his last name. Yes, Nick.
He'll be here this week. Hey,
he's
Nick.
so smart. Yeah, he's the next podcast.
Yeah, that's right.
So, go to someone like that. Yeah. Invest in yourself, learn, and then it's a science. Nutrition is a science. And so learning that's been awesome for me. Nice. Number 2, really focusing on whatever I'm doing. Right, so I'm learning the power of focus. Intention. So we are so distracted all the time. We have a million things going on, moms especially. Guys I know too, but we have this grocery list in our mind, and like what's going on after school, and then like, oh, my phone just dings, and focus on one thing at a time. Even if it's 5 minutes of focus. That's great. And then move on to the next thing. So that's been like a huge goal of mine this year, and it's going to be another goal in 2020 is focusing. Because you are just so much better at everything you do if you can just focus on one thing at a time. And let's see, 3rd thing, prayer, obviously.
Good for you.
So
it's super important.
Super important.
Absolutely.
Yeah. Nice.
Yeah.
Cool. Great question. Awesome. Number 2, something would have a positive impact on your health, but you haven't implemented it yet.
Yeah, more.
We all have those.
Yeah, more meditation and ROM WODs, so range motion. Continuing to work on it. I'm so much more mobile than I used to be as a runner. I had a lot of shoulder mobility issues, just overall mobility issues, really. CrossFit has helped me move so much better, but I need to keep working on it. And then I think meditation is so powerful too, just to downtrain that whole like fight or flight response, that whole central nervous system. So that's something I want to start implementing more often. So
cool. All right, and then the 3rd one, do you have any advice for future PTs, physical therapists? Yeah,
so find your niche. Find that thing that like really ignites your soul. And you're probably not going to be able to do it when you first get out of school, because you've put your time in, you have a lot of student loans when you graduate, and you kind of like find a job that like you're going to continue to learn, but maybe it's not your ideal position. Right. But then write down your goals, and at some point go after them. Yeah. So I'm so happy that I did that now and not 10 years from now, right? So I'm 10 years into my career. I have a long way to go. Sure. I'm going to continue to grow. And then say yes more often. Like, just go for like the opportunities that sit in front of you. Say yes. Go out on a limb. Try something. We have one life, so just do it.
Right. Cool.
Yeah.
Nice.
Thanks.
And then, so that was the last of the main questions, but you mentioned resources in the first question. And I just was wondering if you had any resources that you always refer to.
Like go-to
for
person.
Anything.
Oh gosh, a million different people.
Well, people, or like, do you have like a podcast you like to listen to, or?
I try to, again, be kind of well-rounded. I like to kind of dabble in lots of different things as far as, I'm a constant learner and reader. So, if I really want to focus on like DR, for example, diastasis recti, when I was first learning about that, I just like shoved in all the information I could. I go a lot through the Midwest Institute, which does like DNS. They're more like European-based rehab. In Europe, they're pretty like light years ahead of us as far as pelvic rehab is concerned. So I love learning from those people. Herman and Wallace is a great one. Mercier Therapy in Chicago is another great one. So all of those people. And then every coach that I encounter in the CrossFit world.
For sure.
I love to just pick their brain. I always tell coaches, I'm like, if you see anything you want to work on, just tell me. Like, because some people are like, they don't really want to have all that feedback, and so the coaches are a little bit more hesitant to say something. So whenever I'm in a box, I'm like, go ahead.
Go,
tell me.
I agree.
Lifelong learner.
That's right.
And I think that changes for all of us from our focus perspective, because if we're in that constantly learning mindset, like if we come up against an obstacle, then we tend to say, okay, how do we fix that? Like, what are the issues? What do I need to listen? Do I need to learn? Do I need to watch a podcast or listen to a podcast or read a book about it? Let's dive into it, get that fixed, and then we're comfortable there. And now let's move on to the next one. Kind of what you've done.
Exactly what you've done. My thing, so CrossFit and the way you learn, I think, are very similar, right? So CrossFit specializes in not specializing, but I think that's what you should do with your learning as well. So you could specialize in it, but as soon as you get that thing, you should need to move on to something else. You should never just stay on one path. I think
never be satisfied with your skills, because people around you are learning all the time.
Exactly.
And we're learning from each other. There's tons of research all the time, new research that comes out. So that's always my goal is I invest a huge portion of my finances into continuous learning, because that's how I'm best going to serve my patients. Really, that's why we're here, right?
That's right.
Make the world a better place and do good things for people.
That's right.
So, that's what we try to do.
That's good.
I think that's big with, like, in our profession, you need to be, both of ours, I guess, you need to be talking with people and stuff. Like, it's not a great conversation starter if you have no idea of anything that person knows, right?
Right.
So try to dabble
or
in
their
it.
goals or what they want.
Exactly.
Cool.
Yeah.
Well, that's awesome. So where do we find you?
Yeah, so you can look up my website. It's www.minsterindividualizedtherapy.com. My home office is in Minster. My satellite office is here. So I'm here one day a week right now, probably more than that next year. And then the workshops are going to get posted on social media, Facebook, Instagram. They'll be out there. I'll have flyers at a lot of the local gyms. And I'm going to hit like all of the gyms anytime, any of those.
Yeah, that's the goal.
The 24-hour stuff, obviously CrossFit boxes. So, take advantage of that opportunity, because I think the workshops will probably fill up pretty quickly from what I'm seeing.
That will be mobile, that workshop. Yeah, and that's the goal with that. And I think that will, like I said, buckle up, because I think it'll take off like wildfire.
I'm excited.
I want to give a shout out to Tyler and the whole group there at Minster Chiropractic, because that's where your office is at today, right?
Yeah, Minster Chiropractic Center is, they are doing some really amazing things. They use the Cox technique, which is a very gentle mobilization technique that does wonders for people. And post-surgical patients can come see them, which is pretty awesome.
I know I did.
And people that have had, back surgeries and neck surgeries, it's one of the few chiropractic techniques that they can handle. So that's pretty cool. And they are all about getting you back to independence and getting you back to healthy, which is what we all want, right?
Absolutely.
So we all have a very like-minded, same mindset. So
the long-term fix, not the quick fix.
We're excited for that. I know Tyler was able to come over and spend a little bit of time with us, and I think there's a bright future there, incorporating not only physical therapy but the chiropractic side of that. Awesome things for our perspective from January moving forward with Dr. Wilson coming in. So the goal here is not just to be a place to come in and lift a barbell for 30 minutes or an hour.
It's a lifestyle change.
It's a lifestyle change. And let us incorporate each aspect of that lifestyle change, so you can go to one place and you don't have to guess. Well, I've got the physical part of it, now what do I do? Well,
comprehensive care.
That's right, comprehensive care.
Good word.
I love that.
Well,
great. I don't know if I have any more questions. I wanted to say thank you.
Thank you guys.
Thanks a lot.
Joining us. This was really good. Yeah. Awesome.
All good.
We get a shout out to O2, Dave.
Cheers.
Boom, boom.
Yeah, we released our first one And he responded on our little note, "Oh baby,
oh baby, here we go."
That's right.
Here we go.
That's right. So
no, but these
stuff.
things are amazing.
Yeah, it's like drinking an IV.
Even though we're not sponsored, I still appreciate you, Dave. You make a good drink.
That's right. Absolutely.
Too funny.
Right on.
Thanks for having me, guys.
Awesome,
Yeah,
for sure. Thanks for coming.
Yep, absolutely.
All right, good job. Yeah,
Ooh, that's good.
that was great.